Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Latent autoimmune diabetes in adults, also commonly referred to as LADA. Now, while the name might appear complex, but today we are here to highlight its importance and relevance. Knowledge about this condition is crucial for fostering awareness and ensuring timely interventions for better health outcomes. So join us as we explore the essentials of latent autoimmune diabetes in adults, empowering you with valuable insights to navigate this significant health topic confidently. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and to help us navigate the complexities, a unique and significant medical condition like LADA, we have with us the esteemed Dr. Anupam Dey. Dr. Anupam Dey is a distinguished consultant medicine specialist and diabetologist currently affiliated with Tulip Care Hospitals in Cuttack. With extensive experience in internal medicine, he has garnered a reputation for his compassionate patient care and deep understanding of complex medical conditions. Dr. Day's expertise also extends to cosmetology, reflecting his multidisciplinary approach to healthcare. Graduate from Christian Medical College, Dr. Day has continually demonstrated commitment to professional growth and excellence in his field. His dedication to staying at the forefront of medical advancements is evident in his approach to diagnostics and treatment, ensuring personalized and evidence-based care for his patients. Dr. Anupam Dey's contributions to medicine are underscored by his focus on holistic health and wellness. Through his work, he exemplifies the value of empathy, diligence, and innovation, making him a respected figure in the medical community. Dr. Anupam Dey, THIP Media welcomes you, sir.
Thank you so much for welcoming me to this interaction. Let's start the session.
Thank you so much for joining us today, sir. So we all understand, that diabetes can be a very complex and often a very misunderstood condition, right? And with a condition with a very complicated name is that latent autoimmune diabetes in adults, which we commonly call LADA. It adds, another layer to this complexity. And many individuals, they may feel uncertain or, even apprehensive about seeking clarity regarding, let's say, its diagnosis and treatment. So to bridge this gap and provide better understanding, I would like to begin this discussion with the most fundamental question that what exactly is latent autoimmune diabetes in adults and how does it differ from our type 1 and type 2 diabetes?
Latent autoimmune diabetes for adults, as it is called, is actually diabetes that is a mixture of both type 1 and type 2. That is why it's also called as type 1.5 diabetes, because
Right.
it is believed that it's an autoimmune condition that causes just like type 1.
Okay.
But the diagnosis usually comes late in adulthood, and it happens very gradually, which is
Right.
similar to the progression that you have in a type 2 diabetes. Hence,
Okay.
it's typically diagnosed initially as type 2 diabetes and
Right.
later on recognized as LADA.
Okay.
It's been around for quite a while, but
Right.
now only we are understanding the complexities of it. And
Right.
it is got similar points of both diabetes, but in itself is a very different form of diabetes.
Right. And probably that is the prime cause of the confusion, around this particular condition. Right, sir. And you just mentioned that this is an autoimmune condition, right? Which is, so the development would be somewhere around similar to other autoimmune conditions. So, but I'm sure there might be some risk factors, that may be associated with its development. So, are there any risk factors which are responsible for the development of LADA?
No, LADA is a very hybrid status,
Right.
primarily caused by autoantibodies
G.
that are formed against the insulin secreting beta cells of the pancreas.
Okay.
Now, um, the predilection for that comes from the fact that it arises from insulin resistance.
Okay.
Uh, and the risk factors for insulin resistance are nearly similar as in other forms of type 2 diabetes, like obesity,
Okay.
smoking, alcohol,
Right.
dietary factors. So
Okay.
the lifestyle factors remain the same.
Right.
Uh, Another important aspect is probably the family history of autoimmune disease. If
Okay.
the family has autoimmune disease history, then that sensitizes the individual to have LADA.
Okay.
There are certain environmental toxins and viral diseases which can also incite an autoimmune response in the body, and that can trigger autoantibodies formation also. Variants in the HLA gene can also lead to autoimmune condition in LADA.
Okay. Right. So, right. And now from the question that any patient would, ask a medical professional here, that somebody, who would be visiting a doctor, I'm sure they might be experiencing some clinical signs of this particular condition. So, what are the common signs and symptoms of LADA, and how can individuals, distinguish it from other forms of diabetes, let's say in particular stages or the early stages of this condition?
Actually, the signs and symptoms remain quite similar to type 2 diabetes. Frequent urination, excessive thirst, excessive weight loss, despite normal appetite, fatigue,
Right.
blurred vision, lethargy, slow wound healing. So, all these symptoms are diabetes, normal type 2 diabetes symptoms for which the patient would land up at a doctor's clinic saying ki I might have diabetes. What
Okay.
becomes specific for recognizing LADA is uh, an increasing nature of uncontrolled sugars. In spite of starting the patient on OHS, you
Right.
find that the sugars are rising, going fasting, going above 270 mg per dl,
Right.
and the patient having a lower BMI.
Okay.
Still maintaining, which is very different from what type 2 diabetes is.
Right.
This is where the difference comes. That type 2
Right.
diabetes, the BMI is high, but here the BMI will be lower
Oh,
and the sugars will be increased in spite of very good control and
right.
very good control in diet and lifestyle. Sugars will go on increasing and the age factor is beyond 30. So
Okay.
anyone who is above 30 who has increasing nature in their sugar pattern plus has a lower BMI should be suspected of LADA. This should be the trigger to go on to test for LADA and screen LADA.
Right. And like you just rightly mentioned, that screening is mandatory, to differentiate LADA from particularly the most important misdiagnosis is type 2 diabetes. So, sir, in line with the same thing, what diagnostic tests are used to confirm LADA, especially when it is misdiagnosed as type 2 diabetes?
Once you suspect that this could be LADA,
Right,
actually the ADA guidelines of 2025 they make it sure that if you are above 30 years and
right,
have a lower BMI uh,
right,
and you are seeing a pattern in sugar which is going on increasing in spite of lifestyle factors being properly managed, then you
right.
should screen for LADA. And
Okay,
the main antibody that is produced is the glutamic acid decarboxylate antibody,
right,
GADA as it is called. Now,
right,
testing for GADA is available and we can test for GADA. And once you find higher titers,
Right.
know that this is latent autoimmune diabetes for adults, and
Right.
then we can then go on to do a C-peptide. And with
Okay.
C-peptide, we can then find out what are the treatment options based on the C-peptide levels.
Right. Right. Okay. Okay, right. And once somebody has been diagnosed and the diagnosis have been confirmed, and they come to you for the treatment, so how is LADA medically addressed in such cases? I mean, do we have
Uh,
the routine treatment regime for such patients like
yes.
insulin
We
therapy
we
or
uh,
lifestyle changes or medications?
we do have treatment plans drawn based on the C-peptide levels. If the
Right.
C-peptide is less than 0.3,
G.
then we go for a multiple insulin therapy like in type 1 diabetes.
G.
The therapy is totally insulinized strategy.
Okay.
But if it is moderate increase between zero point 0.3 and zero point 0.7,
Right.
then we can do both, start patient on insulin as well as anti-diabetics and
Right.
see their progress, because
Okay.
the disease will worsen gradually. So we can at this stage start both. And if it is more than zero point 0.7, then
Okay.
we can start on OHS, anti-diabetics, oral anti-diabetics, and see the progress. With careful monitoring, we should be able to manage the sugars very well.
Okay. Right. Right. And you just also mentioned that the condition usually, takes the onset with patients or let's say individuals who are above 30, somewhere around that age bracket. Right, sir? So I believe that such people may be, working professionals as well. So another question that actually comes to my mind here is that does work-related stress impact, let's say, the onset or the progression of this particular condition? And if so, what stress management strategies would you recommend for individuals who are struggling with this condition?
Yes, actually, you're quite true in mentioning about work-related stress. It's a very good question because it's
Ji,
directly related. Why?
ji,
Because uh, in a recent study, we found that 55% of individuals in India,
ji.
they go through work-related stress at some point in their life. Nearly
Right.
50 to 60% are going through
Ji.
stress related. And with increased stress comes increased levels of cortisol.
Okay.
And with increased cortisol, what happens? The insulin resistance increases. There's
Right.
damage to more beta cells, and that is the basis of LADA. Where
Ji.
there is beta cells get damaged. So it is stress has got a direct relationship with development of LADA. And it is very important that to control LADA, we need to manage our stress levels in very good, uh, very good levels. So
Ji.
one of the basis of that is basically trying to compartmentalize stress in different areas.
Right.
For instance, sleep hygiene. We call it sleep hygiene because you have to start maintaining a sleep
Yes.
pattern. The circadian rhythm has to be perfect. Maintaining
Yes.
a stipulated hours of sleep, waking
Yes.
up every time at the same time, going to bed at the same time, and
Right.
having good quantity of sleep is very important. So
Yes.
also is time management to make sure that you don't overstress yourself. And then doing capsule based work. I call it capsule based work, which means that you work, but you work in small, small capsules so that you don't overstress yourself. Work in spurts and take breaks off. Having a good family time is also very important to have your stress levels managed. Then mandatory meal timings are very important. Food in India, we tend to neglect food in a very manner in that work related issues happen, and we tend to delay food. That has not
Right.
to happen. And then obviously regular exercise and yoga, all this will lead to stress management. If we are not managing stress properly, LADA becomes uncontrolled.
Right, right. And you just mentioned that if we do not manage LADA on time, there can be, the condition might just worsen. So, sir, does this uncontrolled LADA affect other organs, let's say heart or kidneys or the eyes?
Yes, like in other forms of diabetes, LADA has its effects on the heart, as well as the kidneys, as well as the eyes, um, causing the usual microvascular and macrovascular complications.
Right,
But in LADA, at its most dangerous period, LADA
right.
affects more. Why? Because there is direct endothelial injury of the blood vessels.
Okay,
LADA causes, due to LADA, there is insulin resistance.
okay,
There's more insulin resistance, and where the beta cells are damaged, and that will lead to um, direct damage of the endothelial lining of the vessels,
right,
and that will lead to your usual atherosclerosis and micro and macrovascular complications.
right,
Um, Also, because of high oxidative stress,
right,
constantly rising hyperglycemia,
right.
and insulin resistance as well. All three, all three combined make a very huge effort on the heart as well as the kidneys and the eyes, causing diabetic retinopathy also.
Okay, right, right. And now I'm going to ask something that we've been working on, and that is raising awareness, or let's say health literacy. So, sir, uh, what is the role of health literacy in preventing and managing LADA? And how can greater awareness, help individuals recognize, let's say, symptoms early and seek appropriate care?
Um, Health literacy has a very big role actually, because
Right.
until and there is a lot of confusion, as you rightly said, that what is this new type of diabetes that is coming? There is a type
Yes.
1, there is a type 2. I do
Yes.
I don't have type 1. I don't have type 2, or I don't have type 2. I have type 1. It's very clear in that. But
Right.
LADA causes a lot of confusion. And people have to understand that the concept of autoantibodies and how the autoantibodies are damaging the beta cells of the pancreas and causing this form of diabetes. Now,
Right.
only when we make them aware of the condition do they understand.
Correct.
Um, so spreading awareness is actually a key form of management, because
Right.
only when the individual realizes that I'm over 30, my diabetes is not decreasing, it's increasing rather. I have a
Right.
good health status, and yet I have a very bad sugar. Will
Right.
it hit him that this could be LADA, and I should land up at my doctor and ask him if this is LADA. Now, that
Right.
form of awareness can only come if we spread talks about it, if we talk
Right.
about it in the social media, if we talk about it uh, every any point, because um, this is actually got a greater capacity to damage and cause micro and macrovascular complications than type 2, and
Okay.
it worsens. So people go on insulin eventually, like type 1
Yes.
diabetes. So
Yes.
there are these questions, that why was I on oral drugs and why should I now take insulin, is a very difficult question to answer right at the level of the doctor. This
Right.
awareness will make them undergo that change of thought process and help them to recognize the disease. So awareness has a big role, and literacy about it is very important, because otherwise we cannot control LADA. in any way.
Right. Absolutely. So I'm just simply going to, summarize this wonderful session on LADA by just asking, sir, that what advice would you give to your patients, you know, who are at risk of LADA to reduce their chances of, let's say, developing the condition, or the ones who've already developed in, reducing the progression of this condition?
No, the best advice would, first of all, would be awareness.
Right,
We have to make them aware that this is a condition that can happen after 30 mostly,
right,
and they need to go to the doctor. So regular doctor visits,
right,
regular regular diabetes care,
right,
trying to assess your health status and sugar status, and seeing the sugar pattern, how
right,
it is being managed. Then
right,
lifestyle modifications have to be put in place so that uh, they understand that without lifestyle modifications, even this one cannot be controlled. That it
right,
has stress management where in
right,
the scenarios where they work. If
right,
one gets educated, then the whole office starts getting educated about LADA.
right.
So, propagating the theory that LADA could happen to anyone, not
Yes,
just a specific group
yes,
after
yes.
30, that will suffice the plan.
Right, right, sir. So I suppose studying your sugar level pattern and then, following proper lifestyle modifications, or let's say having healthy lifestyle choices, and then, appropriate or optimal stress management is the key here. Wonderful. Also, on that beautiful note, sir, I really appreciate your presence with us today, and I am hoping that this enlightening information shared will be valuable to many families. So, thank you so much for joining us. It's
Thank you
really
so
been a
much.
pleasure. Thank you, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.
Thank you.